and we and other jurisdictions are returning to a more normal life. But I urge Albertans to continue to follow the rules that are still in place. This is especially critical in continuing care settings where enhanced measures will remain in place even once we're into step 2. Please respect those rules and do your part to help keep those vulnerable residents safe while they receive the care that they need. We want to continue to support each other through this transition, and that means respecting each other's choices and accepting that people will transition at their own pace. So thank you, and I'm now happy to take questions.
Thanks, Minister. We've got a couple of reporters on the phone, so we'll go to the first caller, please.
The first caller is Carrie Tate from Globe and Mail. Please go ahead.
Hi, thanks for taking my call. Minister, I'm wondering if you have a goal for childhood vaccination rates in light of the push in March.
Yeah, we haven't set a specific target, but we would like to increase it and move closer and even achieve the average across the country. We do know that when initial surveys were done, roughly 1/3 of the parents in Alberta were interested in getting their kids vaccinated. We've surpassed that, but I do know that when we compare ourselves to other jurisdictions, we are one of the lowest in the country, and I'd like to actually reach the average for the country, and this is one step in that direction, is providing easier access for parents to get their kids vaccinated.
Thanks, Minister. Follow-up, Carrie?
Sure. Minister, why do you think parents in Alberta are more reluctant?
Yeah, really great question. We've seen that before, and even in terms of the initial surveys that were done, that there tend to be more reluctance. I think honestly, some parents are taking a wait and see attitude in terms of, we'll see, how the rollout goes, and I also understand that some parents who have seen their kids get COVID with the Omicron wave, which has been so prevalent throughout the province, at this point in time, maybe saying, okay, I'm going to hold back if they haven't got vaccinated. But again, I would, urge all parents that the best protection, even if someone has actually had COVID, is to get vaccinated, and urge them to do so. And hopefully the changes we announced here will make it easier and increase the vaccination rates.
Thank you.
Thanks, Minister. We'll go to the next question, please.
Next question is from Elise Schulte, CBC Calgary. Please go ahead.
Hi, Minister. It's actually a non-COVID question for you, sorry. But your expert advisory panel last year recommended a shift to more community-based care for elders and seniors. Your government has said it's working on a plan to address that. Can you tell me, do you expect to see significant changes this year on that file? And if so, what should we be watching for in tomorrow's budget?
Yeah, so a couple of things. As you know, we did a facility-based continuing care review that was done last year. Government is working on a response to that, and you're quite right. As part of that review, is looked at more community-based care, and also be able to expand our continuing care system. So when moving forward, we have legislation, continuing care legislation that we'll be introducing this session. And that's going to help us renew our legal and regulatory framework, because right now we have different acts that apply to the continuing care setting, and it's across the field. It's very complex, and it's difficult to manage. So we're bringing that all under one act, and then over the course of the next year, our focus will be is getting the regulations right, so we can actually move towards a policy environment that supports care at home, because that's what we heard loud and clear. In addition, we've talked about before our need to support the continuing care sector, and as well as there's going to be an increased demand, basically for more continuing care spaces. So I'm not going to jump the gun for tomorrow, but you will see a focus on us in terms of expanding continuing care spaces over the next year.
Good. Thanks, Minister. Elise, follow-up?
Thanks. Yeah, I appreciate that. As you know, and you mentioned, there's a capital investment that's been recommended, and that's included some new models like these small care facilities. At the same time, advocates have been working with your government to look at what additional programs in the community that seniors would need to stay at home longer. Do you expect most of the funding will be for experiments and research in that area, or are you actually getting ready to roll out some of these new programs and grants at a larger scale this year?
Yeah, so we'll have to wait for after the budget, but again, our focus is on getting the policy environment correct, and then looking at new model, like capital, and then also looking at new models to be able to provide services to Albertans, particularly those who would actually otherwise need continuing care spaces.
Thanks, Minister. So we had just 3 callers initially, so we'll take just one more, the last of the 3.
Next question is from Kevin Nimick, CTP Calgary. Please go ahead.
Hi, Minister. You announced new COVID deaths reported in the past 24 hours, but we still haven't heard about reported deaths from the previous 96 hours. So how many deaths did Alberta Health record between Friday and Monday?
Yeah, so those numbers will be updated. Actually, I think they're being updated on the site as we speak, in terms of all the numbers for the last 4 days. So if you just go to the site, you can see them there, and they're being confirmed as we speak.
Thanks, Minister. Kevin, follow-up?
Yeah, I'm on the site and they're not here. I'll keep checking, but could you elaborate a bit more on what the technical issues are that your team's facing?
Yeah, so there is a detailed amount of assessment that the teams that double check. They were able to do it very quickly for today's update for 24 hours, but doing over a 4-day period, my understanding there's a significant amount of work to do that. I thought it was actually done, and they're updating it, the site right now, but it should be done within the next few minutes, and then if not, we can actually get that to you through our press secretary, Steve.
Thank you.
Great. Thanks, Minister. Thanks to the callers. There were just 3 today, so that wraps it up for today. Thanks again, Minister.
Thank you, everyone, and have a great afternoon.